Uncorrectable life-limiting congenital abnormality. So if patient has something which cannot be treated and it is limiting his life, better not to go for the risky surgeries in those patients. Hi guys, welcome back to the PrepLadder NEET SS. Dr. Patil here, and in this video, I'll be taking you through the treasure of the PrepLadder NEET SS platform. So on the PrepLadder app, if you go to a section called treasures, you will get such beautiful compilation of information which is very essential and extremely high yield for the NEET SS exam. Okay, so today what I'm going to do is I'm going to take you through one treasure which is talking about the contraindications for liver transplantation. Right, so we have already learned in the hepatology modules the indications, contraindications for the liver transplantation. Here is a quick summary of it. What are the absolute contraindications? Anyone who is having an uncontrolled extra hepatobiliary infection, right? It's an absolute contraindication. And active untreated sepsis. As long as sepsis is active, preferably don't go for the liver transplantation. Once the sepsis settles, yes, you can. Uncorrectable life-limiting congenital abnormality. So if patient has something which cannot be treated and it is limiting his life, better not to go for the risky surgeries in those patients. Then if patient continues to have active substance or alcohol abuse, like those alcoholics who have developed cirrhosis and they are the candidates for transplantation, if they continue to consume alcohol, even the liver that you transplant will become cirrhosed later. And also there is a moral ground behind it, because the liver, especially the dead donor livers, are in limited supply and the patients who are needy are high. So it is better to give to a patient who is likely to have a expected survival after the transplantation than to someone who might accelerate the degeneration of the transplanted liver also. Okay. Then those who have advanced cardiopulmonary disease, definitely it's a surgical risk, so better not to go there, right? Or those who have extra hepatobiliary malignancy. Only important MCQ point here is we are not including the non-melanoma skin cancer. So if you have an extra hepatobiliary malignancy, which is basically like squamous cell carcinoma or basal cell carcinoma, it is not an absolute contraindication. But if you have a melanoma skin cancer, it is a contraindication. Okay. Then anything where you have a metastasis to liver is going to be a contraindication. Having cholangiocarcinoma or AIDS, like AIDS, not HIV, is going to be a contraindication. Now coming to the relative contraindications, age more than 70, right? Limited age expectancy as well as higher surgical risks. Then prior extensive hepatobiliary surgery that might make the transplantation challenging. Portal vein thrombosis, renal failure, which is not because of the cardiorenal syndrome. You cannot directly blame the liver for the renal failure. Then previous extrahepatic malignancy, not including the non-melanoma skin cancer, and severe obesity. Severe malnutrition or wasting, you can correct it and then consider for surgery. Then poor compliance to medical management, because patient needs to follow the suppressive medications post transplantation. Then patients who are HIV seropositive, who have failed to control the viremia, or those whose viral load is high, or those whose CD4 count is less than 100. These are all relative contraindications. Okay. Apart from that, intrahepatic sepsis is a relative contraindication. An untreated active sepsis, which is the focus is outside the liver, is an absolute contraindication. If the focus is in the liver, it is a relative contraindication. Similarly, those who have severe hypoxemia secondary to right to left intrapulmonary shunt, PO2 less than 50 millimeters of mercury, is also a relative contraindication. Okay. Then patients having severe pulmonary hypertension with MPAP more than 35 millimeters of mercury. What is the defining MPAP to call someone as having pulmonary hypertension? Mean pulmonary artery pressure more than or equal to 20 millimeters of mercury is what we call as pulmonary hypertension or pulmonary arterial hypertension. If it is severe, when it is more than 35 millimeters of mercury, it becomes a relative contraindication, and obviously uncontrolled psychiatric disorders. So for more such condensed information, high yield files, go through the PrepLadder NEET SS app and go through the treasure section.
Subscribe and press the bell icon so you never miss an update from PrepLadder.